As with any other dental dam isolation, make sure you check the contacts of the teeth so that you know that you're going to be able to get the dental dam in place. So you want to make sure to do that before you put your clamp onto the tooth. Then you would ask the patient, or if the patient found that they have very dry lips, they could put chapstick on their lips, or we do have some Vaseline that they would be able to take and put on their lips in order to keep them moist during this procedure. Then you're going to punch your dental dam. If need be, you could lubricate the holes with KY jelly. It helps to get the dam, it goes over the teeth and through the contacts a little bit easier. Then what you want to do is you want to place your bow of the clamp in the anchor tooth or the key punch hole. And the bow is always going to be distal towards this is the back of the mouth once it goes on. So the bow of the clamp always goes this way. And if you can see, I'm putting pressure on the clamp so you can see the jaws point towards the anterior or the front of the mouth. And this is the anterior teeth that we have here. Then what you're going to do is you're going to want to flip this dental dam back. It exposes the forceps holes. Place the forceps tips into the holes. Squeeze the forceps in order to open up the clamp. With your mirror, you're going to want to use the mirror in order to see the lingual surface. And then visually, you can see the vestibular. And slowly release. Now you want to take and expose the clamp. Sometimes this dental dam can get twisted, and what I've done previously is I've actually made a hole at the patient's upper right corner of this dental dam so that I know that that is always going to go to the patient's upper left side of their mouth. That way it helps you, if the dam gets twisted, to orientate yourself and the dam how it should go. Now the next step is to expose the jaws of the clamp. So you want to expose the jaws. So don't be putting the frame on until you expose the jaws of the clamp. Okay, so you can see how the jaws are exposed. That entire 1/6 is exposed as well. You can do one of two things. You can go to the anterior teeth and expose them at this time, or you can put your frame on, and I'm going to choose to put my frame on. So as you can see, I'm going to do the top first. Then I will put my ligated material around my frame. Secure it in place. And now I'm going to put my dam on the frame's bottom prongs. These are the prongs. Take the most anterior hole, expose it over that central, expose the lateral, then the cuspid, now your 4 and the 5, the premolars. Sometimes if the dental dam doesn't go through the contacts the first time, you can take the same piece of floss and the other end of the floss, ease it through, and what didn't go down the first time will go down the second. Then what you want to do is just take one end, one tail of the floss and pull it through. Remember, as I have previously mentioned, apply pressure against the tooth and gently rub the tooth to help to invert the dental dam in order to keep the saliva from seeping through the dental dam and interfering with the procedure. Once again, if you needed stabilizing material, you could use a corner of the dental dam. And that's going to help to stabilize or hold this part of your isolation in place. You could use the floss or a wedge it. Or if it's going to stay on its own, then you actually don't need to put anything in there. But this is what you call stabilizing material. Check the lingual surface to make sure that all of the teeth are inverted. If need be, take your inverter and tuck the edges underneath. All of these areas here, as you can see, are nicely inverted, and all I did was use the floss. I don't even need to use my inverter for the vestibular surface, but for the lingual I just needed to use it for a couple of the areas. The saliva ejector gets placed on the opposite side to the working area. We are now ready for the dentist to come and complete the procedure. The dental procedure has been completed, and it is time to remove the dental dam. Hand your patient a tissue, as they will want to wipe their face after the dental dam comes off. A lot of times it is quite moist underneath the dental dam. Remove the saliva ejector. Remove the stabilizing material. Line up your forceps with the forceps holes. Open your clamp and lift it off of the tooth. Place your fingers between the lip and the dental dam and cut the septum, dental dam. From the vestibular surface, not the lingual. Remove the frame and the dental dam together. And at the countertop, you would do the next step, but for video purposes, I'm going to do it right here. Remove the frame. Make sure the pieces go back into place so you haven't left any dental dam interproximally. As a precaution, go in and just go through the contacts, flossing that area, making sure that there isn't any dental dam left behind. And at this time, if need be, you would give the patient a full mouth rinse.